Welcome to Acera's Medicare Transition webinar. So here's what we're going to talk about today. We're going to do a Medicare overview. We're going to talk about Acera and our Medicare mandate. We are going to talk about how Medicare works and the different plan options. And then we have time for questions throughout. So just go ahead and type your questions into the Q&A throughout. Okay, so who is eligible for Medicare and who's involved? Well, generally, it's people who are age 65 and older. There are some people that have certain disabilities that are under 65 that are Medicare, that are able to be Medicare eligible, like people at any age with end-stage renal disease or ALS, which is also known as Lou Gehrig's disease. So that could make you Medicare eligible earlier than 65, but generally it's when you turn 65 that you become eligible for Medicare. Okay. And also who's involved is the Social Security Administration, who's kind of over the Centers for Medicare and Medicaid Services, also known as CMS. Oh, and I see Ish is joining us. So let me go ahead and promote Ish to panelist. Okay, Ish, are you there?
Yes, I'm here. I'm sorry, I had a little technical difficulty.
Oh, no worries. No worries. So can you see the screen that I'm sharing?
Sure, that's fine.
Okay, excellent. So yeah, we just did, I didn't get very far. I just did the introduction, so the agenda, who's eligible for Medicare and who's involved. And now we're at currently receiving Social Security.
All right. Well, thank you, Mike. Thank you, Mike, for keeping the bus moving.
Absolutely.
So good morning, everyone, and thank you for attending this Medicare Transition Seminar. Today, I hope to provide you with lots of information regarding the ins and outs of getting Medicare, becoming Medicare eligible, and the benefits that you're now eligible for. Okay, and try to see if we can save you some money also, all in the loops. Okay, so as Mike was saying, okay, if you are currently receiving a Social Security benefit, they say that it's an automatic enrollment when you become Medicare eligible at age 65. But I'd like to always encourage you to still give Social Security a call just to check in, just to make sure that they have all your current information so that they can go ahead and get your Medicare card to you. Okay, so Medicare Part B, they would deduct from your Social Security check. Okay, if you're not collecting a Social Security check, because some members like to wait till you're a little bit older, because that way you get a bigger check, then what they'll do is they'll bill you directly. They'll send you a quarterly bill. So they'll bill you for 3 months at a time. Okay, now, so your Medicare will automatically be mailed to you. Okay, some members, depending upon how things are going with Medicare, you might receive it several weeks in advance. Sometimes, especially now during this pandemic and how the mail service is at, you might get it closer to the month that you turn 65. You might even just get it the month of or the following month after. But usually they're pretty good at getting it to you before you actually turn 65. Okay. Again, some retirees or dependents, who are disabled may be eligible for Medicare earlier than age 65. So if you have a dependent or if you have a disability, you can contact Social Security and they can check to see if you fit the criteria to be granted Medicare earlier than age 65. Okay, and that's actually a good thing because the premiums on the Medicare plans are extremely much lower. So you would actually save money if you're granted your Medicare earlier. Okay. Next screen. Okay, so again, if you're not receiving a Social Security check, you want to go ahead and make sure that you reach out to Social Security to inquire about your Medicare. Okay, you would want to wait at least 90 days prior to your 65th birthday. Okay, if you do it too early, they're going to tell you you're too early and they can't even enroll you. They won't accept your application for enrollment. Okay, so the number there, the 1-800 number, you can give the Social Security call. Like I said, if you've already collected Social Security, they'll go ahead and get this thing automatically, but you do want to check in with them, I would say, just to make sure that they start the ball rolling. Okay, so they'll check your information, make sure everything's current. And so, yeah, we're going to go ahead and get the process started for you. Okay, you can always go to their Medicare website right there to try to enroll in the Medicare Parts A and B. Okay, so some members do go that route. I know that right now, the offices, I believe they may have their offices back open again. But if you do go to walk in to see someone face to face, you want to make sure you try to make an appointment because otherwise it's just like it's kind of like the DMV. You're going to be there for a long time if you don't have an appointment. So it's always good to try to make an appointment if you are trying to go in and see someone face to face. But otherwise, you can go ahead and do it online there. Okay. All right. So Sarah's Medicare Mandate. Okay. So when you or your dependent become Medicare eligible, which is usually at age 65, in order to continue enrollment in our plans, you must go ahead and enroll into the Medicare plan. Okay, so you become Medicare eligible, you or your dependent, you get your Medicare, and then you enroll into a Medicare plan. Okay, so for Kaiser, it'd be the Kaiser Permanente's Senior Advantage Plan. For those who do not wish to go into a Kaiser Senior Advantage Plan, they may contact via benefits and get enrolled into a Medicare plan that's nationwide. Okay. All right. So here's a way to kind of show you how you can save some money when you actually become Medicare eligible. Okay. In this example, we're going to use a member who has 17 years of service. Okay. They're turning 65 and become Medicare eligible. This member is on the Kaiser HMO. Okay. The current premium this year is $810.72. We would subsidize $433.99, leaving the out-of-pocket to come out of their monthly retirement check of $376.73 is their cost to be on that HMO. This same member becomes Medicare eligible, enrolls into Kaiser Senior Advantage Plan, and that premium currently is $382.21. Sarah, we would subsidize $382.21, leaving an out-of-pocket cost for their monthly benefit of $0. Okay, so basically their net increased by that $376. Okay, that's a pretty good jump upward of money to bring home. Okay. Okay. So what is Medicare Part A? Well, when you become eligible for Medicare and enroll, okay, Part A provides hospital insurance. Part A helps to pay for hospital stays, skilled nursing facilities, rehabilitation, not long-term care, but it does handle hospice care, home health care, some blood, inpatient items, and also hospital care from qualified Medicare providers. Okay, and you typically do not pay a premium for Part A coverage, okay, as long as you paid Medicare taxes while you were working. Now, some members, for example, if you're a safety member and your entire career came in and became a safety member and you did not pay into that, okay, so you still can go ahead and get the Medicare Part B. Okay, so if you're being informed that you would have to pay the premium for Part A, okay, you can go ahead and waive the Part A and just get the Part B. That will still allow you to enroll into a Medicare plan and reduce your premiums tremendously. Okay, I'll talk more about that in just a moment. Okay. So enrolling in Medicare Part A. So for the majority of us, Part A costs nothing because you or your spouse or your ex-spouse were married for 2 years, paid Medicare taxes while working, and earned the quarters needed to be able to have that for free. So to get the Part A free, you have to have at least 40 plus quarters, and you get the Medicare will go ahead and grant you the Part A. If it's less than 40 quarters, then they charge you an amount. Of course, if you didn't pay anything at all, this current year they're charging up to $471 a month just to have the Part A. Okay, so you want to make sure that you do let them know that if they do say that you're going to have to pay for Part A, you can go ahead and waive the Part A and just get the Part B. Okay. If you don't enroll in your Medicare time when you first become eligible at age 65, then of course there's a Part A late enrollment penalty. You don't want to have to pay any additional fees at all for any of these items. Okay. So the penalties are usually you have to pay a higher premium for twice the number of years that you could have had Part A but didn't sign up for it. Okay, so for most of us, it's free, so it's best to go ahead and sign up for it. What is Medicare Part B? Medicare Part B provides the medical insurance portion. It helps to pay for Medicare-approved doctor services, outpatient care, certain preventive care services, diagnostic tests, things like that, supplies, things that Part A does not cover. Okay, and there is a premium for the Part B. For most members, the Medicare premium for Part B in 2021 was $148.50. Okay, and that's the lowest standard premium that they charge for the Medicare Part B, which matches what Acera grants into your monthly benefit. I'll be speaking about that in just a moment. Okay, so again, this premium is normally deducted from your Social Security check. If you're not going to Social Security check, then they will bill you this amount quarterly. Okay, so they'll bill you for 3 months worth every quarter. Okay, so many preventive care supplies, things like that. To know if a test item or service is covered, you can always go onto their website and take a look, and it'll help identify what items are actually covered. They also send out a book, My Medicare, like 2021, or it's probably going out 2022. But it's a nice book. You can also download that book from their website. Or then you can always just click along their website and view and ask questions. They do have a feature where you can ask a question and someone will respond to you. So enrolling in Medicare Parts A and B. Okay, again, if you're already getting Social Security, okay, they'll go ahead and get you automatically enrolled, unless you're still working or you have end-stage renal disease. Okay, you'll be automatically enrolled and receive your Medicare card in 3 months or so from before your birthday. That's usually about the window time, but again, with this pandemic and how the mail service has been, it may be a little bit tighter. It all depends on how things are going over there with them. You can apply online, you can call Social Security, you can visit the nearest office, fill out an application for enrollment for the Part B. You can submit it in person or mail it in. Okay, you got to remember, completing the application form and submitting it does not automatically enroll you in Medicare Part B. Social Security must first determine if you're eligible to enroll. Okay, so they'll be taking a look at your record as far as what they have. Okay, so enrolling in Medicare Part B at the right time is critical. Remember I mentioned about penalties. It's a 7-month window. Okay, it's 3 months before your 65th birthday. Okay, and it's also the month of your birth, and then 3 months, 3 months after. So that's the 7-month window. Now, if your birthday falls on the first of the month, then your effective date from granting for Medicare is actually moves up earlier to the prior month, to the month before. Okay, and it's only if your birthday falls on the first of the month. If your birthday falls on any other day than the first of the month, then that month that you turn 65, that's the eligibility month. Your Medicare is always going to be effective the first of the month. Okay, then they don't make it effective your birth date. It's always effective the first of the month. For example, November 1st or December 1st, January 1st. It's always the first. Okay. Now, Social Security enrollment period. If you missed your initial period, okay, they do have another period where you can sign up for it. It's January through March each year. However, the coverage for the Medicare will not become effective until July 1st of that year. Okay, so if you miss your enrollment period, you can still enroll January through March, but your Medicare will not become effective until July 1st of that year. Okay. Again, when it comes to Medicare Part B, it is a lifetime penalty, 10%. That can add up for each month, each 12-month period that you did not enroll in the Part B when you became eligible. Okay. Now, the exception is the working aged. You may delay enrollment in Part B until you retire. The working age, that's what they call it. If you're still working, okay, then they call it the working age. But typically, if you're still working, you can go ahead and waive and delay your enrollment into the Part B. That way you can not have to pay that premium until you actually stop working. Okay. So again, you don't want to delay in enrolling. You want to make sure you get your Medicare in the time frame that you should be getting it. Okay. Okay. So here's about the working part. Okay. So if you are still working, okay, then you can delay your enrollment in Part B and just use your employer plan. Okay. Or you can enroll in Parts A and B and have both Medicare and your employer plan. There's likely no benefit for this because what happens is Medicare is going to see that you have a plan through your employer, and they're going to say, well, your employer plan is primary. We're not going to pay any for any of these services. Yeah, the bill needs to go to your employer plan. Okay. The other option would be is to reject your employer plan and enroll in Medicare and then supplement in other ways, which of course that's not the best option that you want to select. Okay. So again, if you are still working, you want to delay, waive enrolling into Part B. Just contact Social Security, let them know, hey, I'm still working. I want to waive my enrollment at this time until I stop working. That way they can go ahead and make note of their system. Again, you're enrolled in your employer group plan. So they're going to be covering everything 100%. Why pay premiums to Social Security and Medicare, and they're not going to pay anything? All they're going to say is, okay, you're on an employer plan. They're going to take care of your services. We're not going to pay this bill, but thank you for the premium. Yeah, no, let's not do that. Okay. So here's a way how they calculate out what the Medicare Part B premium will be. So currently for 2021, okay, they always do a 2-year look back. Okay. So if your yearly income in 2019 for what you paid in 2021, so they look back at what you filed for your taxes 2 years before. So in 2021, they're looking at 2019. As you see in the chart, filed individual tax return, $88,000 or less. You scroll across to the right, your monthly premium is the $148.50. Okay. If you are above $111,000 or up to $138,000, you scroll to the right, you see your premium for the Part B will be $197. If you're filing joint, okay, you and your dependent are filing together. Okay, as long as it's your tax reporting is $176,000 or less, you scroll to the right, you see it's $148.50. Okay. Now sometimes this occurs for members where they may have got an income lump sum. For example, they said they got an inheritance for that 1 year. Something happened in a year, you got some inheritance, you got some money. So when you do your taxes, it bumped you up to a higher bracket. Okay. Okay. You can always contact Social Security. They're always willing to listen and try to work things out. If it is an error, they can go ahead and make modifications. Otherwise, they may say, okay, we'll revise it next year, because they do revise and review every year. Okay. So sometimes you might sell some property. Of course, that's going to look like a big income, or you may cash out some money from one of your IRAs or deferred comp or something like that, which again will boost you up tax-wise. So you can always communicate with Social Security in regards to that, so that they can understand that it's a one-time thing. It's not like you're going to be selling a house every year. Okay, so it's not like it's your regular income. Okay. So the program that here at Acera that we have, which is a great program, is the Medicare Part B Reimbursement Plan, MPRP. And this plan was adopted by the board to help assist members and with the Part B premium. Currently this year, the amount for 2021 is $148.50. So it's not tied to a medical plan. So you don't have to be enrolled in one of Acera's medical plans to be eligible for this Medicare benefit. Okay, it's a years of service benefit. Okay, so this is only for the retiree members, not available for dependents. Okay, so to qualify, you have to have had at least 10 years of service, okay, or have been granted a service-connected disability. In addition to that, you have to provide proof of enrollment in the Medicare Part B, okay, and you have to remain enrolled. Okay, so for example, you have 10 years of service, 10 plus years of service, you complete the Medicare Part B reimbursement application form. It's real simple. It's basically your name and address. Just mark the box that you're attached your Medicare card, and then sign it and send it back into Acera with a copy of your Medicare card, and then we can go ahead and activate this benefit, granting you into your retirement benefit the $148.50. Okay, so basically, Social Security will deduct your Medicare from your Social Security check. Okay, they take $148.50 from your pocket over there, but here in your pocket here at Acera, we're putting in $148.50. Okay, and the board only adopted for the $148.50. So if your income is a higher bracket, and Medicare is going to charge you one of the higher amounts than above the $148.50, we are only going to reimburse you the $148.50 because that is what is approved by the board. Okay. This is important. This is not a retroactive benefit. Okay. So you want to make sure you complete the MBRP form and supplies with a copy of your Medicare card as soon as you get it so that we can go ahead and get that set up into the system so you can start collecting that money. Okay. Again, enrollment is not automatic. Okay. So you must complete the form and send it in with a copy of your Medicare Part B. All right. Again, enrollment in a Acera medical plan is not required because this is a years of service benefit. So you can be enrolled somewhere else. You know, some members are enrolled under their dependents plan with another employer, or they maybe have gone back to work somewhere and they're getting benefits that way. That's fine. This is a years of service benefit. It's not tied to you having to be enrolled in a Acera medical plan. Okay. Part D premiums by income. Okay, so this is important. So when you enroll into a Medicare plan, okay, for example, Acera's Kaiser Senior Advantage plan, that is a Medicare Advantage plan. So your Medicare is assigned to the Kaiser plan. Okay, basically you're saying to the Medicare that, hey, I have Kaiser, I'm going to be going to Kaiser, that's where I'm going to be getting all my services. And then they go ahead and take care of the items with Kaiser behind the scenes. So you don't have to worry about submitting any claim forms or anything like that. You just utilize your Kaiser card when you go to Kaiser. Okay. Now, Part D prescription, the prescription plan is already built in to the Kaiser Senior Advantage plan. Okay. So you do not need to enroll into a separate standing Part D prescription plan. Okay. And you don't want to do that because if you do, then what happens is Medicare will see that you've enrolled into another Part D plan, and then they disengage the Medicare from Kaiser, which causes you to lose the medical coverage. So again, Part D prescription is already built in to the Kaiser plan or Senior Advantage plan. Okay, so you don't have to sign up for a Part D prescription plan outside. I know you may get some of these items like, oh, sign up with us. We can get you your prescriptions for $1.50. This and this and this. Here's a duffel bag. You don't fall for none of that. You already got the prescription plan through Kaiser. It's a $10 copay on that plan. Now, even though you have the prescription drug plan through our carrier, okay, Medicare, they do this review and they take a look at your file, taxes filed. And again, what they do is they take a look and you see the first one, filed individual, $88,000 or less. You scroll to the right, your premium, okay, so your premium, I believe it's zero. It's supposed to be zero. If you're above 88,000 to 111,000, you scroll across, they're going to charge you $12.30. And it's not necessarily a premium that you're paying to have Part D. This is basically called an IRMA. It's an IRMA. Okay, It's a monthly medical adjustment that Medicare charges. It's kind of almost like a punishment, is what you kind of look at it, because they're charging you an additional premium adjustment because you made over a certain dollar amount. It's almost like a penalty. Okay. And yes, you do have to pay this premium, this IRMA that Medicare will send you if you fall into this category. Because if you do not, what they do is they turn around and they will disenroll you from Medicare. So they kind of got you, in a box here. So if you do have a higher income and they send you one of these IRMA bills, make sure you go ahead and pay that. Okay, this is for the Part D IRMA. Okay. Types of Medicare plans. There are two types of Medicare plans. You got your Medicare Advantage plan, which is basically like an HMO. Okay, you have a primary physician. You got your medical card from that insurance company. You go see your doctor. You show your card. You pay your copay as applicable and so forth. Okay, and those plans are typically tied to a specific area. So you got to make sure you reside in a specific area of the zip code service area for that plan. Okay. All the plans, they do have emergency services. So if you are traveling and you're in another state somewhere and you get sick or injured, you can go to get emergency services and get taken care of. You're not allowed to just go to any doctor and say, okay, well, I want to go ahead and have my wellness physical, since I'm out here visiting anyway. You can't do that. It's only emergency services when you're traveling. Okay. The Medigap or supplement plan, those plans, your Medicare is not assigned to a medical carrier. Okay, so you retain the power over your Medicare. Medicare is nationwide, which means the plan is nationwide. So you can be on a Medigap or supplement plan and see any doctor, go see any specialist without a referral, utilizing your Medicare. Okay, if Medicare pays, what happens is Medicare takes care of their 80%, and then the supplement plan picks up the other 20. Okay, again, this is nationwide. So if you're here in California and the doctor says, hey, you need to have this procedure done to your eyes or your knee or whatever the case is, and you're thinking about it, okay, well, the best doctor for this, the best specialist is over in Miami. Okay, you can contact that doctor and double check to make sure that they accept Medicare. They say yes, boom, you can go ahead and hop on a plane or a train, however you want to get there, get to Miami to see that specialist, utilizing your Medicare to see that specialist, because Medicare is nationwide. You can see any specialist that accepts the Medicare. Okay. Again, you don't have a primary MD assigned. Okay. Any doctor that takes Medicare, you can go ahead and go see. You'll see any facility and so forth like that. You will need to enroll in a prescription drug plan. Okay, so the Medigap plan covers the medical portion. You would still need to enroll in a Medicare Part D prescription plan. Okay, copays and deductibles, they may vary depending upon the type of plan that you select. And again, the entire service area is the United States. Is the entire service area. Okay, so again, Sarah, we only have Kaiser Senior Advantage Permanente, okay, which is a Medicare Advantage plan. We do not have any Medigap supplemental plans. If you don't want to be on our Kaiser Senior Advantage plan, then you want to contact Via Benefits, and they can help you to enroll into a Medigap or supplemental plan that best suits your needs and you can select. Okay, and they can assist you with that. Okay. Screen. Okay, again, these are the plans that are offered by Sarah. Okay, on the non-Medicare, we have Kaiser Permanente HMO. We have United Healthcare Signature Value HMO. We have United Healthcare Signature Value Advantage. Okay, now when you become Medicare eligible, you have Kaiser Permanente Senior Advantage. Other than that, you would contact Via Benefits to enroll into a plan. Now, some members who are on United Healthcare, they don't want to go to Kaiser. Okay, so they could contact Via Benefits and enroll into a plan there. If you did that, when you go over to Via Benefits, okay, United Healthcare isn't necessarily called United Healthcare once it becomes Medicare in the Medicare or Medicare grouping. Basically, it's still United Healthcare, but they're called something different, kind of like Secure Horizons and so forth like that, those types of different names. Those plans, if you ever got anything from Secure Horizons and so forth, you see it'll say Secure Horizon, but then in a very small print below their logo, it'll say a United Healthcare division or subsidy or something like that. United Healthcare is a very, very large conglomerate that owns a lot of other insurance companies. Okay, so they've pretty much gobbled up a bunch of the smaller ones like Pacific Care and Secure Horizons and a bunch of others. Okay, so they left their names like that. So they, I don't want to be on United Healthcare. I'd rather be on Secure Horizons. Well, surprise, it's still the same company. Okay, so that's how they work things out to make sure that they're taking over different markets in different areas. Okay, our Kaiser Permanent Day Senior Advantage Medicare plan. Okay, again, our plan is only for California residents and you must be residing in the service area of the Kaiser plan. Okay, and they're always expanding. Kaisers, if you haven't noticed, it seems like their buildings and facilities are just popping up brand new all over the place. So they're always expanding, and I'm sure they're going to continue to expand. Okay, in regards to the premiums. Okay, so for example, this year for self, it's $382.21. Self plus one, both with Medicare's actually $382 twice, which is the $764. And then, of course, if you have an additional dependent, it's down to $1437. Okay, now our current HMO, Kaiser, okay, your copays are $15. When you become Medicare eligible and join the Senior Advantage Plan, your copays drops down to $10. Okay, which is good. I mean, depending upon how many medications you're on, saving $5 a pop can make a difference. Okay. Also, with the Kaiser Senior Advantage Plan, new for 2022, okay, as of February 1st, we are having the Silver and Fit gym membership added on as a benefit. Okay, it's going to be for plan year 2022 as of February 1st. You'd be able to contact Kaiser. There are flyers. There was a flyer in their open enrollment packets that went out. You can always contact our office or check our website to get a hold of that flyer that basically lets you know how to go ahead and get advantage of that Silver Fit gym membership. Okay, so that's a big plus. We've been working on that for quite a while. So hopefully everybody enjoys that. It is only going to be for a 1-year basis just now because we're not sure if everybody's going to want to use that. If we don't get enough utilization, the board may decide to not continue that into 2023. So if you're on Kaiser Senior Advantage, go ahead and sign up and take advantage of that senior Silver and Fit gym membership. Okay.
And Ish, we have a few questions up on the board. The first one is, do you need to apply for Medicare Part B reimbursement plan at the same time as applying for Medicare?
I would say yeah. It's always good to go ahead and you can complete the form, in advance and send it in. Then we will be watching for you to provide us with a copy of the Medicare Part B card when you get it. Okay, so it's okay to go ahead and complete the form and send it in, and we can have it on your record that you've completed the form, but we wouldn't start the reimbursement until we have the proof that you have the Part B. Okay, some members wait till they get their card and then they send them both in together. However you want to do it, you just want to make sure that you send it in, try to send it in before you actually become Medicare eligible. So, if your Medicare is becoming effective granting February 1st, and you get the form, you get the card, send it in before that. Don't wait till March and then remember I got to send this in and send it in and expect us to go back to the February 1st and grant you the reimbursement for February because we didn't receive all the necessary documents until March if we sent it in March. So then we would start it accordingly. Okay, so we're going to start it upon receipt of all the required documentation. Okay, again, there's no retro on this side.
Okay, and then there's one of them is just a comment. It says is asking you to speak up because your voice keeps dropping out at the end of the sentence. So maybe If you make sure you're close to the microphone, that would work.
Okay, let me adjust that real quick.
And then there's
Okay,
another question. Can I enroll in Kaiser Medicare and then change to via benefits later?
okay, good question. And the answer to that is yes. And during open enrollment every year, you can go ahead and change to a different plan. Okay, so if you wanted to jump on Kaiser Senior Advantage this time around, becoming Medicare eligible is a qualifying event. So now's your chance to go ahead and jump into this plan. Other than that, you during open enrollment, which is the entire month of November each year for us, Sarah, you can go ahead and enroll into another plan due to the open enrollment window. Okay, so with via benefits, the open enrollment on that side, because all of those are individual plans, they're not group plans. Those the Medicare enrollment for open enrollment over there opens up October 15th and runs through December 7th. So you have plenty of time to make a decision if you want to jump ship and go over there, or if you want to remain on the Acera plan. Okay, because we do send our open enrollment guidebooks and information out, early October. So you get it, you can see what benefits we have, what the new premiums are going to be for the following year, and then you can make a call, check in with the benefits if you like to see what other plans that they have available that you might be able to get into, what their cost may be, and then you can make a decision as far as did you want to stay with us or you want to go to via benefits to get a plan elsewhere. Okay.
Okay, and last question. I've applied for Medicare but do not have a card yet. Can I still enroll in Senior Advantage and do my open enrollment?
Depending upon when if you already applied for Medicare, you can go ahead and complete the Senior Advantage enrollment form. You can send it in to us. We can go ahead and take a look at that, and then we can go ahead and get that over to Kaiser accordingly. Because what happens is when we get your enrollment forms, we have a specific team at Kaiser that handles our group members. Okay. Yes, I know the form will have the address for Kaiser in San Diego. Okay. And some members inadvertently go ahead and send it there to that address, but it's always best to go ahead and send it here to Acera so our team can review the form, make sure everything's filled out correctly, and then we securely transmit that over to our Kaiser team that handles our members. This way, we have a copy of your document on file, and then we also make sure that our Kaiser team that handles our members gotcha. If you send it in through the main address with Kaiser in San Diego, it's going through their main processing hub. So that handles everybody, not just Acera, but any individuals there, wherever is it trying to enroll, they get all of those. Okay, so it may take a moment for it to actually, circle back to get to our team so that we can go ahead and know that you actually did complete the form and so forth. Okay, but that team, they do have a Medicare unit, and they will be processing the form. And when they go into process, they have access to the Medicare screens. They'll be able to see that you did apply for Medicare and it's in pending status or whatever status Medicare has placed you at. Okay, so yes, that's fine. If you want to go ahead and complete the form, go ahead and complete the form, get it into us. Okay, and just remember when you do that, remember to complete the MBRP form. Also send us a copy of the Medicare card. That way we can make sure we have everything in your record here at Acera. Okay, and remember, they do not do retro. Okay? Medicare does not do retro. So if you're becoming Medicare eligible, let's say, for example, January 1st, okay, you want to make sure you get us your form and so forth, at least try to get it to us at least 30 days before. The sooner is better, but at least 30 days before. Because if you wait until, like January 30th or February 1st, thinking that, okay, well, my Medicare is effective January 1st, they're going to make it January. No, they're not. It'll be now the next month. So you miss that 1 month where you could have been on the lower plan. Okay, which means that, remember the HMO was 810. Okay, and there's a larger out of pocket for you. That means you still have to pay that out larger out of pocket because we didn't receive your document to get it over to Kaiser to get processed and approved earlier. Okay, so the sooner we get your documents, the sooner we can get it over to Kaiser, get you approved, the sooner we can reduce down your premiums from that 810 down to that 382 that you see on the screen. Okay.
All right, that's it for now.
All right. All right. Via benefits, Medicare plans. Okay. So again, these are through the Medicare exchange. They're not in the SARA group. These are individual plans. These will not show up on your monthly retirement statement from a SARA. So right now, you take a look at your statement from a SARA that we pay you monthly. You'll see the deductions. You either see United Healthcare, or you see the Kaiser deduction and so forth. And then to the that's on the right side, but then to the left side, the lower box, taxable, non-taxable subsidies, you'll see those same deductions, and you see the credits of your monthly medical allowance that we're putting in as a credit to offset those deductions. Okay, so these plans with your benefits, they're individual plans. You're not going to see them on your monthly statement anymore. Okay, we don't have those. Members of defense are solely responsible to pay the premiums to those carriers, okay, to maintain that insurance. So when you roll into a plan with via benefits, you want to make sure that you set up, where that insurance carrier can go ahead and do the deduction for your premiums, unless you're actually going to be mailing them a check every month, which is kind of iffy because remember the post office isn't always reliable to get things there quickly. So you want to make sure that you got everything set up to that insurance company can get their premiums from you. Okay, that insurance company, they receive your premium. Okay, then they turn around and report to via benefits, hey, we receive blah blah blah's premium payment in the amount of this amount for this month. Via benefits will then take a look at the health reimbursement account. They see that a service placed money in there for you. They pull out the money that you've paid for the premium amount, and they go ahead and send you back the reimbursement to pay you back your out-of-pocket premiums. Okay. Again, members who are eligible for a SARA monthly medical allowance are granted a health reimbursement account for your out-of-pocket medical items. So for example, your premium for your medical insurance, your premium for your prescription drug plan, your co-pays when you go into a pharmacy to pick up medications, okay, all that's out-of-pocket medical items, all that you can submit to get reimbursed for. Okay. Only the retiree members are eligible to submit claims through the health reimbursement account. So if your dependent has out-of-pocket premiums or costs at the pharmacy, those items cannot be reimbursed through the health reimbursement account. It's only for the retiree member. Okay.
And we have a question.
Yes.
In open enrollment, can we enroll our dependents under a different health plan, i.e. regular Kaiser?
Okay, so as you, the retiree member, you are the primary anchor. So if you're on Kaiser, your dependent has to be on Kaiser. They cannot be on United Healthcare. If you're on United Healthcare, your dependent has to be with you on the United Healthcare. They can't turn around and say, well, no, I'd rather have Kaiser, be on Kaiser. It doesn't work like that. You're the retiree primary anchor. Their dependents must be enrolled in the plan that you are enrolled in. Okay.
Okay.
All right, here we go. Via benefits enrollment. Okay, they don't have an office that you can walk into to complete items and forms with. It's all done through the phone. Okay, they have 2 massive call centers in different parts of the United States that will take your call and set you up with an appointment for a benefit advisor, who then will go through the plans. They find out what you're looking for. They ask you questions. You'd also want to have all your prescriptions ready when you make that call so that they can run your prescriptions through this prescription profiler that helps to identify which prescription plans would best cover all your prescriptions and at what costs. And they can answer that question for you and letting you make that decision. Okay. Again, most Medicare Advantage plans have Part D built into it, which is the prescription portion. Okay. On the individual side, carriers do require both Medicare Parts A and B. Okay, so if you're one of the members who decide to waive your Part A because Medicare was going to charge you a premium for the Part A, so you waived Part A, just got your B, got into our Kaiser Senior Advantage Part B only plan. Okay, and now all of a sudden you relocated. And you need to get a plan through elsewhere on the individual side. Those individual plans and carriers, they do require A and B, which means you would need to contact Social Security and inquire about getting your A if you only took the B earlier. Okay. Now the thing about that is you may be impose some penalties because you didn't take the A when you first became eligible to be able to get it, even though it would cost you something to have it. Okay, so that's the thing, you want to keep that in mind. Okay, but so on the individual side over there, they do require A and B. Okay, it's only with our Kaiser group that we were able to get a Part B only plan to help accommodate the members who would have been charged that high premium of the $471 for the Part A. So you do not have to pay that Part A, just get the Part B, we get you on our Senior Advantage plan. So with VIA benefits, individual plans, they do require both A and B. Okay. Plans over there are nationwide. Okay, reimbursements are available for the retirees out-of-pocket medical items. So you make sure you can get all your items reimbursed for you. You can set up auto pay, and you can also set up direct deposit. Okay, so you set up auto pay to where the reimbursement item comes through, that's reported by the carrier. VIA benefits would automatically set up and boom, issue you back your reimbursement. And then you can get it via a mailed check, which I don't recommend, or direct deposit. So when they're going to issue you your reimbursement, they can just redirect deposit the reimbursement right back to your account. Okay. Reimbursement for the current year must be claimed by March 31st of the following year. So every month, there's an allotment that goes into your health reimbursement account. For a vast majority of members, okay, they do not use up all the money that we place in the account. Okay, so come at the end of the year, vast majority may still have a balance, but at December 31st, once midnight hits, that balance is wiped up to zero. So now January 1st, we start the new year fresh with the new amounts. Okay, so if let's say, for example, it's now going into end of January, maybe even February, and you realize, oh, I had these services last year and I paid for these and I didn't send in my claim for these. Okay, well, you have until March 31st to submit the claim for those items for the prior year. Okay, if you had a balance at the end of that year, for example, at the end of 2021 this year, if someone still has a balance and they realize later on afterwards into the new year in 2022 that they still had some items, they got until March 31st to send in for those items that they had during 2021 that they didn't submit for. And if they had a balance at the end of the year of 2021, whatever balance is there can be utilized to help pay for those services and for out-of-pocket items that did not get claimed for. Okay, so you still have some time. Again, your online health reimbursement account, VIA Benefits has a website. You can track your HRA account. You can check the status of your claims. If you submit a claim, you can watch it and see it as received, pending, approved, and so forth. Okay, you can also submit your reimbursements online through their website. Okay, so there's quite a bit that they have available on their website.
And we do have a follow-up question.
Yes.
Says clarifying the last question. If
Okay.
I'm on Senior Advantage, but my husband is not old enough yet, so he can be enrolled during open enrollment for the regular Kaiser HMO. I think the question is about if one of you is regarding Kaiser, if one of you is Medicare eligible and one of you isn't.
Okay, so basically what happens is whoever's Medicare eligible can enroll in Kaiser Senior Advantage, and the non-Medicare person can be on the HMO. That's how that would work.
And then there's a different premium that you get
There's-
because the
yes.
one isn't eligible for Medicare yet.
Right. The non-Medicare person that's going to be on the HMO with Kaiser, remember that right now that's 810. And whoever's got the Medicare, the Senior Advantage, that one right now is 382. So those will be the premiums. And then of course we would subsidize accordingly for the retiree member against which plan they are enrolled in.
Great.
Okay. Again, the VIA benefits, the prescription profile is a very good benefit resource that they have. So basically, and most members that are over there, the vast majority, they once they get into Medicare plan, they're good to go. It's the prescription plan that we always let them know to double check to see if anything's changed and it can be better for you. Because as you know, these prescription pharmaceutical companies are always creating things. Prescriptions are always changing tiers as they develop brand new medications and so forth. So you always want to double check to see if you're still on the best prescription plan for you. Okay, because as these items change tiers or new prescriptions are created, you know, the prices change for some of these medications. So you want to make sure that you're getting the best coverage for your prescriptions, you know, every year. So what members do is they'll contact VIA benefits and they'll have their prescriptions ran through their prescription profile. And what that does is it goes through and it searches the databases to all the different prescription drug plans. And then they can tell you, okay, well, hey, if you're on this plan here, your copays are this for your prescriptions, and this is what your premium is. This other plan, your same prescriptions are actually at a lower copay cost, and the premium is lower. Okay, so they'll be able to tell you what's different, and then you can make a decision. Okay, do you want to stay with your current one, or do you want to jump over to that other prescription drug plan? Okay, sometimes some of the medications will be a lower price on some prescription drug plans, and sometimes they'll be a higher. So they'll be able to, you know, provide you the details on that, and you can make the decision if you want to stay in the plan you have or make a change to a different plan. Okay, so you want to make sure you do that usually around mid-October. You can go ahead and contact them. I would probably say maybe wait till late October, because the open enrollment with VIA benefits, remember, it's individual plans, so we're talking nationwide. You know, anybody that's Medicare eligible or what have you is trying to call to make changes. So at the very beginning, you don't necessarily want to make a call right at the beginning, which is October 15th. Mondays are not good to call. That's everybody's start of the week and everybody's trying to reach in. So maybe during the middle of the week or so forth, you may try to make the calls if you're trying to reach out to them on something. Okay. Again, open enrollment, your annual opportunity to assess your benefits and make the changes. Right now, you're becoming Medicare eligible. So that's a qualifying event which allows you to make the change. After this, then you'd have the annual open enrollment. Okay. The only other thing that can allow you to make a change is if you have another qualifying event. So for example, let's say you're in a plan and then you decide to relocate somewhere, and the plan that you're on is not going to be available in the location where you're relocating. Well, that's a qualifying event because it's a loss of coverage. You're losing coverage because you're no longer residing in that area. So that's another opportunity for you to make a change. But otherwise, annually, it's open enrollment. Okay. Again, you can make changes to medical, dental, and or your vision plans. You can add, remove, or cancel medical, dental, and vision. Retirees with 10 or more years of service must remain enrolled in the dental and the vision plans, as coverage is subsidized fully by ACERA. Okay, so even if you get coverage elsewhere, you know, and we got members who call us, well, I don't need my dental plan or my vision plan because, you know, I'm covered under my spouse, under her employer, his employer, whatever the case would be. Okay, then that's fine. You can go ahead and be on their coverage, but because you have more than 10 years of service, your dental and vision with ACERA will stay intact. We can't terminate that coverage because it's an agreement that we have with Delta and with VSP that as long as our members have 10 or more years of service, we will go ahead and put them on the coverage, as we are the ones that are paying for it. Okay, and it's an agreement to help have them keep the premiums at a much lower cost than what they would normally charge. Okay. Again, ACERA's open enrollment occurs every November. Okay, so and you'll know about that because we send out quite a few items on that, and also you get the big open enrollment packet with the new guide for the next year. Okay, elections made during ACERA's open enrollment does become effective February 1st. So our plan year runs February 1st through January 31st. If you're going through VIA benefits, okay, that open enrollment is October 15th through December 7th. And those elections and changes that you do become effective January 1st because it's a calendar year, January 1st through December 31st. So remember, there's a difference between their effective date and our effective date. And the monthly retirement allowance must be sufficient to cover the cost of the selected healthcare plan that you select if you're on an ACERA group plan. Okay. So here's the MMA, or the subsidies. Okay, so again, although it says 20 or over 100%, these percentages, 100%, 75%, 50%, that was just like a threshold marker. It doesn't mean that your premium is actually being covered by 100% or 75% of it or 50% of it. It's basically a threshold, just a marker for the years. Okay. Now, back in the day, several years ago, that 20 years of service, 100%, yeah, that was solely true because the medical premiums were so much lower back then. But then eventually it got to a point where the premiums were just skyrocketing with all the insurances. And so even though if someone has a 20 more years of service, 100% mean that 100% of your premium is going to be taken care of. Okay. Each level has a maximum, and these are the maximums. So as you can see, from 2019 to 2020, did bump up by about $20 or so, and now for I don't have my 2022s in there. Okay, so as you can see, the 2020-21, it stayed the same as the 2020. In 2022, the amounts have gone up. Okay, so the 20-year member at 578 for 2022, that's going to be 596.73. So it jumped up even higher. That 433.99 is going up to 447.55, and the 289.33 is going up to 298.37. Okay, that's on the top box where the blues are. In regards to the Medicare exchange, okay, once you become Medicare eligible and you go over to VIA benefits, your 20-year plus, that 443 will now be 457.13, and then the 15 to 19, which is 332, will become 342.85, and that 221.64 becomes 228.57. So the MMAs, subsidies, and so forth have increased for 2022 slightly, which every little bit helps. Okay. Now, some members may say, well, why is it that, I'm pre-65 and my maximum, for example, is at 578, and all of a sudden I become Medicare eligible, and now I'm only eligible for that 443. Well, there's a big reason for that. Okay, the Medicare plans are extremely lower than the non-Medicare plans. Okay, so for example, on our Kaiser Senior Advantage plan, okay, for next year, this year it's 382. For next year, it's only 344. It actually went down in price. So as you see, if you're on our group plan, we're going to subsidize that entire 344. So it's all gone. There are plans with Medicare that when you go through the exchange, there are some plans that are like almost unbelievable to believe that it's actually true. There are some that have no premium. Now, I'm not sure how much good of a coverage that is, but they do have some that says no premium. Okay, no copays. But we do have some members, for example, I know some members who are like over in another state, they're like in Georgia, and their plan, Medicare Advantage plan, is like $49. Okay, so there's no, and if we're putting in for them, even if we're just putting in a 221.64, okay, they're never going to run out of that money because their plan is only $49 a month. So that 221 is more than enough to cover that plan. And then of course the copays for any prescriptions they may have, they can still go ahead and apply for it. So the plans through the VIA benefits, okay, on the individual side that are Medicare, those plans are much, much lower in premiums. So there's no need to have such a high MMA amount for the HRA. Okay, all that's been done and approved, and we did a formula for all that. Okay, so very few members ever use up all the funds that we put into their HRA when they go over to VIA benefits. can almost count them on my hand, one hand, how many members there are. And the reason that those members run out is because they have an ailment that requires them to be on special compound medications. And if you have any knowledge about medications, those special compound medications can run very high. They're very expensive. But again, like I said, we only have like a handful of those members who have an ailment who are getting treatments for something that's costing them a lot as far as medication. Other than that, members don't use up all the funds that we put in there. Okay. And yes, I know we have some that always is concerned about the ACERA money. At the end of the year, when you, if you have a balance left over, via benefits, they never have funds. All the money is always here with ACERA. Via benefits is only allowed to pull the amount that they need to reimburse you for your out-of-pocket items. I'll have some members who will call me up and say, well, I still had a large balance and now I'm wiped out to zero because it's a new year. So via benefits was able to keep all that money. No, they never kept any of the money. The money was always here at ACERA. So whatever money you don't utilize, if you're using via benefits and HRA, at the end of the year, that money just stays right into the ACERA account. So it's always here. We just now start you with a new fresh amount for the new year. Okay. Via benefits did not keep the money, they've never had the money. All right, just to be clear on that. Qualifying events. Again, here we go. So a loss of coverage is a qualifying event that allows you to make a change to a plan. Relocating out of the service area, of course, our annual enrollment, becoming Medicare eligible as a qualifying event, retiring after age 65, marriage. If you get married, you got 30 days to add the new spouse onto your plans. New domestic partner, you have to go ahead and complete the ACERA domestic partner form and go ahead and add the domestic partner onto your plan. Okay, you don't have to be a state registered domestic partner to add your dependent onto a ACERA plan. ACERA has its own domestic partner ACERA affidavit form that you can complete. Okay. Again, moving out of the service area, most members, retirees, once they retire and we activate that direct deposit, they vanish. We have no idea where they disappeared to. As long as the money's in the bank, they're good to go. So, but it's always good to make sure you keep your current address with ACERA, okay, current, because sometimes there are things that occur and we need to notify you. And if we can't get a hold of you, things can get kind of tough because there could have been a situation that occurred and we need to make sure you're aware of it. And yet we can't seem to reach you because you never updated your address with us because you moved. So you always make sure you update your address with us if you happen to relocate, or reach out to us before you relocate, just to confirm that, hey, you're still going to be in the current service area of the plan, because we may need to get you to look at some other plans so that you can make sure that you have coverage. Okay. So again, you can reach out to us, Sarah, and our agents can assist you with that matter. Okay. Again, you must complete an ACERA address change form to update your record. Only a signed change form will be accepted. Okay, you can't call us up and say, "Hey, I relocated. Go ahead and change this," or email us that. Okay, we got to make sure that we have a signed item, and that's for your security as well as ours. Okay. Retirees who reside outside of California may not be required to pay California state taxes. So if you do relocate, you want to make sure you also can get a California state tax form, which is available on our website. And just let us know, hey, do not take I don't live here anymore. There's my new address. I do not take California state taxes because I don't live in California anymore. Okay. Remember to send ACERA a completed address change form, name change request. All these things can be found on our website right there at acera.org/forms. Right. So again, you may email us questions to acera.info.org. We're always ready to help you. And so thank you for viewing and have a great day.